Hey everyone, and welcome Pima Medical Institute Surgical Tech students to this explainer. Today we're getting into something absolutely crucial for your future in the OR, the biological barrier of the skin and how it directly ties into surgical site infections. You already know the basics of anatomy, but since you're the ones who'll be keeping patients safe, understanding the invisible microbial world happening right at the incision site is a total game changer.
So here is our roadmap for today. We'll quickly cover the skin's protective barrier, meet the indigenous microbiota, and then look at the breach, meaning surgical incisions. After that, we'll identify the common pathogenic culprits and finish up with exactly how we mitigate those surgical site infections. Let's get to it.
Section 1. The skin's protective barrier. Let's take a look at our body's fortified castle wall.
All right, so the skin, it's our largest organ, right? Weighing in at about 6 pounds in an average adult, and it is literally our absolute first line of defense. Crazy fact, it handles about 1/3 of all the blood circulating through your body. Up top, you've got that tough, waterproof shield, the stratified epidermis. Right under that is the dermis, which is packed with dense connective tissue, hair follicles, and blood vessels. And then, going deeper, we hit the vital subcutaneous fatty tissue. This whole anatomical setup is just perfectly engineered to keep the outside world exactly where it belongs. Outside.
Moving on to Section 2. Meet the indigenous microbiota, because, as we know, this protective barrier, it is definitely not sterile.
Let's talk about the indigenous microbiota, often called our normal flora. These are the resident microbes that literally call our skin home. And you know, their growth is totally driven by things like moisture, pH, and temperature. Take successful commensals like Staphylococcus epidermidis or Propionibacterium acnes. You'll find them almost everywhere on the skin because they're incredibly resilient. They thrive in high-salt environments, and they just do not dry out easily.
Now, these normal flora aren't just, passively hanging out for the ride. They fiercely defend their turf. They protect us by actively crowding out more dangerous competitors, taking up all that valuable real estate in our pores and on the skin's surface. And, incredibly, some of these species even produce substances that are straight up toxic to other invading bacteria. It's kind of like having microscopic bouncers keeping the bad guys out.
Which brings us to Section 3. The breach, surgical incisions. We've got this fortified wall covered in combative microbes, right? So what happens during that high-stakes moment of a surgery?
What happens when we intentionally break that barrier? Think about it. With a planned surgical incision in just a fraction of a second, the very microbes that were protecting the outside of the skin can get pushed deep into the normally sterile internal tissues.
And this is where we have to talk about what's going on in the tissue layers during surgical closure. When that subcutaneous fatty tissue, which honestly really resembles chicken fat and provides pretty much zero strength to a wound closure, when that lacks tight tissue approximation, it leaves this open, unfilled gap. And in the surgical world, we call this extremely dangerous gap dead space.
Let's watch how fast this builds into a clinical crisis. You make the incision, and if that dead space is left unfilled, the body's natural inflammatory response kicks in. Postoperative serosanguinous fluid starts seeping into that gap. And that fluid? It is the absolute perfect culture medium. It's basically a free buffet for any opportunistic bacteria that got pushed in from the surface layer, allowing them to rapidly multiply and ultimately cause a surgical site infection.
Section 4. Common pathogenic culprits. Let's unmask the opportunists taking advantage of this surgical breach. Because here's the harsh reality. Despite our absolute best sterile techniques in the OR, contamination often comes right from the patient's own skin. Normal flora, like Staphylococcus aureus, which is the most common and pathogenic of all skin flora, can instantly shift from being a harmless neighbor to a devastating threat once it's trapped inside that dead space. And of course, we're also dealing with major threats from Staphylococcus epidermidis, highly resistant strains like MRSA and MRSE, plus E. coli and Pseudomonas aeruginosa.
If opportunists like Staph aureus are left to multiply unchecked in a wound, the results are really severe. We're talking rapid tissue necrosis, cellulitis, or the formation of these really painful carbuncles and boils. Seeing the kind of damage these pathogens inflict once they bypass our cutaneous defenses is pretty sobering, isn't it?
And it definitely gets trickier. Serious pathogens like beta-hemolytic streptococci can cause dermal conditions like erysipelas. But as a surgical tech, you absolutely have to be aware of the lookalikes. Take pyoderma gangrenosum, for example. It's a non-contagious immunologic ulceration, but because it's often triggered by trauma, it gets completely mistaken for a post-op surgical site infection. If a surgeon debrides it, the tissue destruction actually gets worse. Oh, and to complicate things even more, opportunistic bacteria like Pseudomonas aeruginosa can later colonize those non-infected ulcers. It's a real minefield.
Finally, Section 5, mitigating surgical site infections. Wound infections can literally double a patient's risk of death from complications. So let's look at how surgical science actively fights back.
To actively prevent contamination from normal flora hiding out in that dead space, both the CDC and WHO highly recommend using plus sutures. These are your standard absorbable sutures, Vicryl, Monacryl, PDS, Stratafix, but they have a secret weapon. They are manufactured with an antimicrobial coating of triclosan. And the clinical data on this is just incredible. By adding this one simple protective step to the closure process, meta-analyses show a massive 28% reduction in the potential for wound layer infections. 28%! It provides an essential, powerful tool in the war on surgical site infections, working right there at the microscopic site of the breach.
So now that you truly grasp the double-edged sword of the human microbiome, why dead space is so incredibly dangerous, and the tools we have at our disposal, I want to leave you with a thought to guide your clinical practice. As a surgical technologist on the front line, standing sterile at the field, how will you protect the barrier today? Thanks so much for exploring this vital microbiology topic with us, and we'll see you in the next explainer.